Here's what pharma companies aren't telling you. Diabetes has a collection of sneaky warning signs that most people don't even associate with the condition. If these subtle red flags go unnoticed, they could quietly wreak havoc on your health. But today, we're revealing the hidden signs of diabetes that could be going under the radar. And trust us, these are things you need to know. Number 1. Unexplained weight loss. It might sound surprising, but rapid or unexplained weight loss could be a sign of diabetes. When your body isn't producing enough insulin or when cells stop responding to insulin, they're not able to absorb glucose for energy. As a result, your body begins to break down fat and muscle for fuel, which can lead to significant weight loss. This is particularly common in type 1 diabetes, but can also be seen in poorly managed type 2 diabetes. If you've noticed unexplained weight loss without changes in your diet or exercise routine, it's important to consult a healthcare professional. Number 2. Darkening of skin in certain areas. Another subtle sign of diabetes is the appearance of dark, velvety patches of skin, especially around the neck, armpits, or groin. This condition, known as acanthosis nigricans, is caused by high levels of insulin in the bloodstream. Over time, this excess insulin leads to skin changes, which can be one of the earliest indications of insulin resistance, one of the root causes of type 2 diabetes. Many people mistake these skin patches for hyperpigmentation or skin irritation, but in reality, it could be a sign that your body is struggling to regulate blood sugar. Number 3. Blurry vision and vision changes. Did you know that diabetes can affect your eyesight long before you get diagnosed? Blurry vision is a common sign of fluctuating blood sugar levels. When blood sugar spikes, it can cause the lens of your eye to swell, making it difficult to focus. You may find yourself switching between prescription glasses more often than usual, or struggling with blurry vision that comes and goes. Left unchecked, diabetes can lead to more serious eye problems like diabetic retinopathy, which damages the blood vessels in the retina and can cause blindness. Regular eye exams can detect these changes early, so don't ignore sudden or frequent vision problems. Number 4. Persistent skin infections. Another hidden sign of diabetes is the increased frequency of skin infections. High blood sugar levels can compromise your immune system, making it harder for your body to fight off infections. People with diabetes are prone to developing skin infections such as boils, styes, and fungal infections, especially around the feet and hands. A common infection in people with diabetes is athlete's foot, a fungal infection that causes itching, redness, and cracking of the skin, particularly between the toes. If you notice that your skin infections take longer to heal or recur frequently, it's time to take action. Number 5. Fruity-smelling breath. One of the more alarming signs that diabetes is out of control is fruity-smelling breath. This symptom occurs when your body begins to break down fat for fuel instead of glucose, leading to the production of ketones, which give your breath a fruity or sweet odor. This can be a sign of diabetic ketoacidosis or DKA, a serious complication of diabetes that requires immediate medical attention. DKA is most commonly associated with type 1 diabetes, but it can occur in type 2 diabetes during times of stress or illness. If you or someone you know experiences fruity breath, along with nausea, vomiting, or confusion, seek medical help right away. Number 6. Numbness or tingling in hands and feet. Many people with diabetes experience numbness, tingling, or pain in their extremities, especially in the hands and feet. This is known as peripheral neuropathy, a condition caused by prolonged high blood sugar levels that damage the nerves. While this condition often develops over time, the early signs can be subtle: a slight tingling or burning sensation in your toes or fingers. If left untreated, neuropathy can lead to more severe symptoms, such as loss of sensation or even amputation in extreme cases. That's why it's critical to address this symptom early on. Number 7. Slow healing wounds. Another warning sign of diabetes that people tend to overlook is slow healing wounds. High blood sugar levels can restrict blood flow, which slows down the healing process for cuts, scrapes, or sores. Even minor wounds may take weeks to heal, especially on the feet and legs. This can make you more susceptible to infections, which can become dangerous if left untreated. If you notice that your wounds are healing more slowly than usual, Or if they become infected more frequently, it could be a sign that your blood sugar levels are too high. Number 8. Increased thirst and frequent urination. While these symptoms are well known, it's important to recognize that increased thirst and frequent urination are often among the first signs of diabetes. When excess sugar builds up in your bloodstream, your kidneys work overtime to filter it out, leading to increased urination. This, in turn, triggers excessive thirst as your body tries to replace the lost fluids. These symptoms often occur together, so if you find yourself making more trips to the bathroom and constantly feeling thirsty, it's worth getting your blood sugar levels checked. Number 9. Unexplained fatigue. Do you constantly feel tired, even after a full night's sleep? Fatigue is one of the most common but overlooked symptoms of diabetes. When your body can't properly use glucose for energy, it turns to fat and muscle, which can leave you feeling drained. The constant battle between high and low blood sugar can take a toll on your energy levels, making it hard to concentrate or stay active throughout the day. If your fatigue is unexplained and persistent, diabetes could be a possible cause. Number 10. Changes in skin texture. People with diabetes can experience changes in skin texture known as diabetic dermopathy. This condition causes small, round, brownish patches on the skin, often mistaken for age spots. These patches are typically harmless, but can be a sign of poor blood circulation caused by diabetes. While diabetic dermopathy isn't dangerous, it's a clue that your blood sugar levels may be out of control and that your skin is losing its ability to repair itself efficiently. How stress impacts blood sugar levels. Certain lifestyle choices also play a big part in the emergence or prevention of diabetes. While most people associate stress with headaches or fatigue, few realize that stress can play a significant role in blood sugar fluctuations. Whether it's physical stress from illness or emotional stress from life events, the body reacts in a way that can have a direct impact on diabetes management. When you're stressed, your body goes into fight or flight mode, triggering the release of hormones like cortisol and adrenaline. These hormones increase your blood sugar levels, giving you a temporary burst of energy to respond to the stressor. However, if you're already dealing with diabetes or prediabetes, this additional glucose in your bloodstream can cause spikes, making it harder to control your condition. Chronic stress, whether from work, relationships, or other aspects of life, can lead to sustained high blood sugar levels, contributing to insulin resistance over time. For someone managing diabetes, this means that even when you're eating right and exercising, unchecked stress can undermine your efforts to keep blood sugar stable. Tips to manage stress. Mindfulness and meditation. Practicing mindfulness can help reduce emotional stress and improve your mental well-being. Studies have shown that deep breathing and meditation can lower cortisol levels, leading to better blood sugar control. Physical activity. Regular exercise not only helps your body use insulin more effectively, but also reduces stress by releasing endorphins, which are the body's natural mood enhancers. Adequate sleep. Quality sleep is essential for managing stress. Sleep deprivation can lead to higher cortisol levels, which in turn increases blood sugar. Prioritize getting 7 to 9 hours of restful sleep each night to keep both stress and blood sugar in check. The role of diet in preventing and managing diabetes. When it comes to diabetes, diet is one of the most powerful tools for both prevention and management. What you eat directly impacts your blood sugar levels, and by making strategic changes, you can significantly lower your risk of developing type 2 diabetes or improve your ability to manage the condition. One of the key principles for managing diabetes is to focus on low glycemic foods. These foods release sugar into the bloodstream slowly, preventing rapid spikes in blood glucose levels. Whole grains, legumes, non-starchy vegetables, and most fruits are excellent examples of low glycemic foods. Foods that help stabilize blood sugar. Leafy greens. Vegetables like spinach, kale, and Swiss chard are packed with nutrients but low in calories and carbohydrates, making them ideal for maintaining stable blood sugar. Nuts and seeds. High in healthy fats and fiber, nuts like almonds and walnuts, as well as seeds like flax seeds and chia seeds, help reduce blood sugar spikes. Berries. While fruit can sometimes raise blood sugar, Berries are an exception. They are high in fiber and antioxidants, which help prevent blood sugar fluctuations. Healthy fats, avocados, olive oil, and fatty fish like salmon promote insulin sensitivity and keep blood sugar levels in check. It's equally important to avoid highly processed foods and refined sugars, which cause blood sugar spikes and contribute to insulin resistance. Foods like white bread, sugary drinks, and fast foods should be minimized, as they can worsen blood glucose control. Replacing these with whole foods rich in fiber and lean protein can make a dramatic difference in managing diabetes. The importance of physical activity in diabetes. Control exercise is not only beneficial for your overall health, but also a cornerstone in managing diabetes. Whether you're dealing with type 1 or type 2 diabetes, physical activity can improve your insulin sensitivity, meaning your cells can use blood sugar more effectively. It also helps lower blood sugar by moving glucose into your muscles, where it's used for energy during and after exercise. Types of exercise for managing diabetes. Cardio exercises. Activities like walking, swimming, or cycling increase your heart rate and help lower blood sugar levels. Studies show that even 30 minutes of moderate intensity cardio can have a lasting impact on glucose management. Strength training. Building muscle. Through weightlifting or resistance exercises increases insulin sensitivity. This means that your body can process glucose more efficiently, reducing the likelihood of high blood sugar after meals. Flexibility and balance. Exercises, practices like yoga or Pilates, can help reduce stress, which indirectly helps with blood sugar control, while also improving physical balance and reducing the risk of falls, which is especially important for people with diabetic neuropathy. One of the key benefits of regular exercise is its ability to lower A1C levels, a long-term measure of blood sugar control. Engaging in consistent physical activity helps your body maintain stable blood sugar levels throughout the day, making it easier to manage diabetes. However, it's crucial to monitor your blood sugar before and after exercise, especially if you're on insulin or other blood sugar-lowering medications. Exercising can lower blood sugar levels significantly, and it's important to avoid hypoglycemia, low blood sugar. If you're new to exercise, start slowly and build up your stamina. Aim for at least 150 minutes of moderate activity each week, and consult your healthcare provider to determine the best exercise plan for your needs. And there you have it. Diabetes is not always about the obvious symptoms like thirst and frequent urination. The hidden signs we've covered today can often be the body's first warning signals that something isn't quite right. If any of these symptoms sound familiar, it's essential to take them seriously and consult a healthcare professional. Don't wait for the obvious signs. Early detection can save your health in the long run. Thank you for watching, and if you found the video informative, then make sure to watch our next one shown on screen.